So the next one is another very important topic that it has been widely discussed throughout the pandemic around the world. So children, one of the things that you have had since the very beginning, so early last year, and now even, is that COVID doesn't affect children. And the tweet goes like this: kids don't transmit or get really sick.
Yeah, unfortunately, this is something that has been going around quite a bit. And this is sort of the rationale of saying, okay, well, we don't need precautions in schools. We don't need to, we don't need to worry about kids. And so, the sort of, this is really stemming from, what we were looking at and seeing very early on in the pandemic, which was that flu tends to affect kids very strongly, and flu tends to spread through schools very strongly. And so early on in the pandemic, they were looking and worrying about that, and discovered that actually it looked like COVID was affecting more of the elderly population and people with high risk groups, that those were the people that were getting really sick. And so they're saying, well, actually, it looks like schools maybe aren't driving the infection. Maybe it's not children. And then as we started to get more and more research, it became clear that actually, yes, children don't get infected as easily as adults. And if they do get infected, they're at a lower risk of having severe infections, and when children get infected, it's more likely that they'll be asymptomatic than adults will. And so, on one hand, this is really good news. I mean, this is great news. But where this sort of intersects with that tweet and the misinformation is, in fact, that children do get severe disease, and children do get COVID, and children can transmit the virus. So some of the studies that have shown that when children get infected, now again, they don't get infected as easily as adults do, but they can be infected. And the more variants that evolve that become more and more transmissible, well, that increases the likelihood that children are getting infected. So if children do get infected, there have been a lot of studies that have shown that they actually transmit the virus just as well as adults do. So, in fact, children do transmit the virus. There have been outbreaks in schools. There have been studies that shown that children can transmit the virus back to their families. Again, children are not the primary driver of this pandemic because they don't get infected as easily. But a primary driver is very different from saying that they don't transmit and don't have a role, because they definitely can transmit. And if you have vulnerable people in the family, then in fact, there's a real risk, or in the community or in the school. But it's also really important to emphasize that just because children have a lower risk of severe disease doesn't mean that children don't get severe disease. We've heard of a lot of cases of MIS-C where children can get severely ill and require hospitalization. We've seen children get ill with just sort of severe acute COVID. We know that this happens. It's at a lower risk than adults, but a lower risk doesn't mean no risk. And if you start to look at long COVID, well, in fact, children actually get long COVID also. I was saying before, children even as young as 2. So if you look at children between the age of 2 and 11, if they get infected with COVID-19, well, then there's a 7.4% chance that they will have symptoms lasting at least 12 weeks. That's not an insignificant chance of a severe illness. And again, as you've mentioned, we don't know how long COVID lasts. And if this is affecting children as young as 2, what is the long-term impact on those kids going to be? So yeah, lower risk does not mean no risk. And the risk for children and their long-term health, their long-term well-being is so significant that it's so important that we still take precautions, that we have precautions like masks in schools and making sure that we have good ventilation and distancing. There are a lot of things that we can do, but it's really important that we don't ignore that, in fact, there is a real risk to children.
The next one is another tweet that is quite packed, just like the one we had recently on Australia.
Right.
And so this one talks about a lot of things. And here it is. Children have a greater chance of being mauled by a tiger than dying of COVID. Why don't you start listening to the science? The virus has a 99.75% recovery rate. The bacteria from face masks and the long-term psychological damage is much worse.
Okay, so again, I kind of feel like anything that goes from tigers to bacteria in face masks, that's a real indication that this is not, genuine conveying of factual information. Um, but sort of just to try and unpack a little bit of this, if I can even remember all the components to go through, but you know, first of all, they're saying follow the science. So yes, absolutely, follow the science. I would encourage this in absolutely everything that we're talking about here. Follow the science. So first of all, I will admit total ignorance here. I do not know what the risk is of children being mauled by a tiger. I don't have that data. But if again, even if, and I don't know if this is true, so even if the exact numbers said that the risk of being mauled by a tiger was exactly the same risk of a child getting COVID and dying of COVID, even if that was exactly the same, that again does not factor in children getting hospitalized and having to be out of school for weeks or months and suffering through a severe illness. That does not factor in at all children getting long COVID and having 12 weeks, 6 months, a year of debilitating symptoms that prevent them from having normal lives, from going to school, from being able to hang out with their friends, from basically having a life. It doesn't touch on that at all. And I can guarantee you the risk of children being mauled by a tiger is, not 7.5%. So, it's again, it's not just about fatalities. You have to think about the illness. You have to think about the severe illness. You have to think about the effect that's having on the children. And you have to think about long COVID. Now, it also mentioned something about bacteria and face masks. And
It said, it said the bacteria from the face masks and the long-term psychological damage is much worse.
So, first of all, bacteria from face masks, I can honestly say I have absolutely no idea what's being referred to here. So I have no idea. My best guess would be that we're talking here about maybe masks getting dirty and being contaminated with other bacteria that might be in the environment. And then maybe somebody getting sick because their mask was so dirty. But first of all, well, okay, look, if your mask is, you're supposed to, switch masks, you're supposed to wash masks. I mean, you wash your socks, so you don't not wash your mask. I mean, so that's one thing is your mask shouldn't be that dirty anyways, and you should have proper use of your mask, so it should never be doing that. I've also not heard of any cases of somebody getting a bacterial infection from their mask. I've heard of no cases of that. So I really don't have anything to say about that. And then, the final part was saying that, COVID is nowhere nearly as bad as the long term effects of this, and presumably implying like the long term effects of children wearing face masks or something like that. And I would say, well, the whole point of this tweet was saying follow the science. Well, we don't know what the long term effect of any of this is going to be because it's ongoing. So we can't follow the science on that because we don't have that information yet. So saying that the long term effect is worse, well, we of course don't have that information. But I would also counter, what's worse, children, occasionally wearing a mask that they can get very used to and really doesn't cause a problem, or children having 12 weeks, 6 months, a year, multiple years of debilitating illness. I think it's pretty clear what the bigger impact is there.
Uh, I would say it is clear. Maybe not for the tiger, but
Right.
the next tweet is it's actually an answer to another tweet. So there's this parent worried about their kids, about long COVID, about the situation in general in Indonesia. And the following is an answer to that worry. This is just a list of your weirdo hangups, as well as some made up stuff. Your kids are at zero risk, zero.
Yeah, I mean, it's really unfortunate. This is again a sentiment that we do unfortunately hear a lot, and we do see a lot on social media, and it's got sort of those two factors. One factor again being that children are at zero risk, which as we've talked about on multiple tweets here, it there is a real risk to children. So and if you sort of leave that aside for a second, there's that other aspect of basically sort of implying that the risk, the fear, the worry about children, that this is all in your head. And whether or not we're talking about concerns about COVID, or we're talking about long COVID, or we're talking about any of this, this is a real disease. This is a real disease that is causing real illness and fatalities in a lot of people. This is not in your head. You can worry about it also, and I worry about it also, but I worry about it because it's a real disease, and because it causes real symptoms, and because it has a real risk. So we know what the risk is. We know the data, and the data says, yeah, well, there is a real risk to children.
The next one is, again, speaks about how kids have an extremely low risk, but I want to mention this specific tweet because it touches another important point, that this debate that shouldn't be a debate that we've seen around the world, and we're seeing it now because school is going to start soon. So the tweet is as the following: kids have an extremely low risk from COVID, so there is no need to balance education versus health or to impose lockdowns before opening schools.
Yeah, so I mean, as we mentioned, of course, there is a real risk to children, severe disease, long COVID. Now, there's a lot of talk here about, the balance between, in-person education and what's going on in terms of COVID. And this does need, a balanced approach. We do know that in-person education is very important. Now, in-person education is not more important than children maintaining their health. That is not, an even trade-off. I don't think any parent would say that, a risk of many months of debilitating symptoms that remove their child from school and from their normal lives is better than, a couple months of virtual learning. Now, that being said, there are a lot of safety precautions that we can do in schools. We know children don't get infected as easily as adults and tend to not have as high a likelihood of having severe disease. So there's a lot of things that we can do, in areas where you don't have robust virus transmission, having in-person learning, using masks, making sure ventilation in schools are good, doing testing and surveillance. There are great things that you can do that can both keep in-person learning going while also ensuring children are protected. Now, of course, if you have rampant virus transmission, then the risks are really great. But of course, the risks would be great to society as a whole at that point. But it's important to say that it doesn't have to be education or the health of children. You can have both. You just need to pay attention to it and to remember that, children are at risk.
And just like you mentioned a few misinformations ago of, it's not like one shoe fits all, right? And in this case, it's the same, right? It depends. What school are you talking about? Are you talking about a school in New Zealand or a school in, I don't know, the UK, let's say? New Zealand, there's low community transmission, and it's been there like that since the beginning of the pandemic, basically.
Right.
So it depends, right?
Of course. And it also depends on what age you're talking about. We know that, the older children get, the closer it gets to adult levels of ability to be infected. And so, what's happening with, grades 8 through 12 could be very different from younger children. And so, it is very situational and context dependent, but it also doesn't have to be one or the other.
Exactly. Very important to underline that part. Okay, so we're done with this topic, very important topic of children. But now we go to another topic, which has also been part of the debates around the world. To use them or not to use them, are they good or are they not good? Masks. So since we just spoke about kids, the first tweet on masks is the following. It is proven that the long-term psychological effects of masks is worse for kids than COVID. If you want to wear a mask, do it. You're not in control of me or my health.
Okay, so, right. In a lot of ways, this is very similar to one of the last ones where, we're talking about sort of following the science and the long-term effects. Well, if you're actually following the science, well, we don't know what the long-term effects could be. We don't have that data. So you can't say that, the long-term effects are worse because we don't know what the long-term effects are. And again, as we talked about with one of the past ones, I'm pretty sure that the long-term effects of mask wearing, which is really, as far as we know, basically nothing, the long-term effects of mask wearing compared to the long-term effects of, long COVID and severe disability in children, there's no question there. But just to sort of touch on a little bit more, there is this idea that, in fact, mask wearing is bad for kids. And, to an extent, this came from a paper that was saying that, in fact, children wearing masks have really dangerously high levels of CO2 and that this would be unhealthy for the kids. But that paper was actually retracted because it was found that the methods that were used were flawed and that it actually meant that the conclusions and the data was incorrect. And so, the data that we do have says that no, there's not any increased risk of CO2 or like any sort of danger to children in wearing the masks. And, seeing a lot of children wear masks and seeing, children in my own family wear masks, it's really clear that, yeah, there's no problem. Kids can wear masks, run around, they can play. Um, you know, yeah, a little bit of adjustment and getting used to it, and maybe they don't particularly like it at first, but I mean, I don't particularly like wearing a mask. This is not like, oh, this is a fun thing to do, but it's also not a health hazard. So that data was proven to be flawed, and in fact, we have very good data that says, that there's not an increased risk of anything about mask wearing. But what we do know is that masks are really good at mitigating the spread of COVID-19. But that's actually where the last part of this tweet really comes into play, is that sort of, this is my choice, what I want to do with my own body, my own choice, which, all right, there's a point to be said about that, what you want to do for your own health personally. But this is a pandemic and this is an infectious disease. So in this case, what everybody does with their own body in terms of the pandemic affects everybody around them. So if you're saying, I don't want to wear a mask, well, then if you get infected, okay, so maybe you don't care about the risk to your own health. Okay. But first of all, then if you do get infected, are you going to use public health services? Are you going to use, hospital resources to care for yourself? Probably. And second of all, if you do get infected, you're going to spread the virus. And if you're not wearing a mask because you feel like that infringes on your freedom, well, then you're putting everybody that you encounter at risk. Children, family, friends, community. That can be people that are vulnerable, that could get severe COVID disease or die. That's putting, people at risk of developing long COVID and long-term debilitating illness. So it's not just your own freedom. It's not just a matter of that. It's also a matter of, looking around to the people in your community and saying, am I willing to put everybody in my community at risk for my own personal choice? So it's not as simple as saying, well, it's just my body, what I want to do with it is fine. If you want to, not take, your vitamins today or something like that, whatever, that's fine. That is your choice. But this is a little bit different. That's like, it's a completely different argument because it's putting everybody at risk.
The next tweet, it's again about masks working, not working, the famous debate that should not be a debate. But the reason I am going to read it out loud also is because I can understand in a way how someone could just take bits and pieces and make up a narrative and just throw it out there and maybe even believe it. So the tweet is the following. If the pandemic is so scary and so bad, and there is this deadly virus, then how can masks help? How is it that a mask will save us?
Well, I mean, on one hand, you could say, well, okay, so, this huge, severe thing and a really simple measure. Well, okay, so I would sort of counter with something equally simple and saying, well, okay, so you have a, severe bacterial infection and you get a simple pill of penicillin. How can that save your life? It just because it's something relatively simple doesn't mean that it's not effective. But in terms of sort of get at the core issue of here of, you know, how do masks work? Why in fact do masks work in this context? And so, you know, first of all, there are a lot of different kinds of masks. You can have, you know, just cloth face coverings, and you can have medical grade masks. There are things like N95 or KN95 or FFP2 or FFP3s. And, you know, those work differently. So basically, the core of this is that COVID spreads through the air. It's a very simple thing. It spreads through the air. So when if I am infected with COVID-19, every time I'm talking, every time I'm breathing, if I'm shouting, if I'm singing, anything like that, the virus is coming out of my mouth or my nose. And again, it's not just my nose, it's not just my mouth, it's coming out of my mouth and my nose, which is why face masks need to cover both. But mask works in two different ways. So first of all, if I am infected and breathing out COVID, then if I put a face mask out, that's affecting how the virus is getting out of my body into the environment. Because if you have a mask on, you know, that's limiting the spread. So if we were in fact sitting in front of each other face to face and not through Zoom, which, you know, when does that ever happen again? But if in fact that was the case, and I was infected and you were not, and neither of us were wearing face masks, the virus would come right out of my mouth and go directly to you. Your likelihood of breathing that in and getting infected is very high. But if I have even a cloth face covering in front of my mouth, then that is limiting the spread. The virus isn't going straight out, it's going to you. It's maybe leaking out a little bit of the sides, but that is very different. It's not spreading directly towards you. And so it's still coming out of the mask at a low level, but it's not spreading directly towards the other person. And so this is why it's still important that even though you have masks, you're still having good ventilation, or you're in outside areas, because they're not stopping all the virus to get out. They're just changing how it goes, so it doesn't go directly to the person, and that really dramatically limits the spread. We have very good data that limits the transmission. Now, there's another kind of mask, the medical grade mask. And these work a little bit differently, because these masks actually form a real seal around your face. They form a seal around your face, and they have material that can actually filter out the virus. So those masks are, first of all, again, very good at stopping the virus from coming out if I was infected and talking to you. But if the situation was reversed and you were infected and talking to me, and I was wearing a medical grade mask, which I couldn't wear a medical grade mask with my beard because I wouldn't form that tight seal. I would have to shave my beard in order to wear that mask. But if I was wearing that mask and had shaved my beard, and you were infected and talking to me, that mask would do a really good job at filtering out the virus. So then my chance of getting infected is lower. So medical grade masks reduce the chances of the wearer getting infected. But both kind of masks, medical or cloth masks, reduce the spread of COVID to another person. And so this is why we recommend everybody at least wear the cloth face coverings, because it stops that spread from person to person.
Yeah. And like you said, there are many things to do. And the more you do, the less risk it is for you. And a mask is one of the things, but it's one of the things that has been shown to work.
Exactly.
So the next tweet kind of concludes this part that we just did, this topic on masks, and introduces the next topic quite nicely, because there's a mix of them. So this is what the tweet says. I still don't get why you have to continue to wear a muzzle in public if you're fully vaccinated. Isn't that the point of getting vaccinated? I'm fully vaccinated, so shouldn't I be able to get rid of the stupid muzzle?
So ignoring just the tone and the muzzle and stuff like that, which, you know, just ignoring that for a second, just saying, okay, so the core of this is, well, why do you need to wear a mask if you're vaccinated? Isn't that the point of getting vaccinated? And, you know, so being vaccinated has two really big impacts. It significantly reduces your risks of having severe COVID disease or fatal COVID disease or getting hospitalized or anything like that if you do get infected. So that's great. Um, and it also reduces your risk of even having more mild COVID disease. But it also dramatically reduces your ability to transmit the virus if you do get infected. So both of those are really strong and something that the vaccine does really well. But again, the vaccines aren't perfect. And so, for instance, the Pfizer vaccine reduces your likelihood of transmitting the virus by 90%. But that still means that there's a 10% chance of spreading the virus. And when you have the Delta variant that spreads even better and starts to evade a little bit of the vaccines, that risk gets greater. And so, again, masks, they're not saying, the CDC guidance is not saying wear a mask to make sure that you protect yourself, because then the guidance would be everybody wear an N95 mask. But no, the guidance is to wear a mask even if you're vaccinated, because you can still transmit the virus to other people. It's at a lower rate, a lower likelihood, but you can. So it's looking at your community, it's taking responsibility that it's not just about you. That if you don't wear the mask, there is a risk to the people around you, and especially in communities and areas, of which there are many, where there are still large portions of the population that are unvaccinated.
Well said. Okay, so now we are in the topic of vaccines. And this first tweet that I'm going to read out loud, I wanted to start with this because it's necessary for us to keep in mind that the pandemic is a thing that's happening globally. Obviously, it's a world problem. And so that means that different countries are in different situations. So the following tweet speaks about basically saying how it is stupid not to get the vaccine, that only stupid people don't get the vaccine. And I wanted to speak about it with you because I'd like you to get into it a little bit more, because we need to keep in mind that some immunocompromised people cannot just get the vaccine, or the ones that they're offered, or depending on where they live, they don't have vaccines, or kids can't be vaccinated or have not been vaccinated, or some countries don't even have enough vaccines for their risk groups. So here's the tweet. At this point, only extremely stupid people are not vaccinated. Why would you play Russian roulette with your life?
Right. I mean, of course, why would you play Russian roulette with your life? And the vaccines are good, but I think it's important to as you said, it's just important to be aware, first of all, that not everybody in the world has access to the vaccines, so not everybody can get it even if they would like to. Also, there are people with underlying health conditions and medical conditions that can't be vaccinated, and that's not that's not stupidity. It's not even a desire to not get the vaccine. It's just medically they can't get the vaccine, and that's a problem too. But then there's also a lot of people that are hesitant about getting the vaccine and haven't gotten it yet. And that's not because they're stupid people. It's not stupidity. There's a lot of reasons why people have hesitancy about it. There are really good arguments that counter that hesitancy, that talk about why the vaccines are still good, why we should trust them. But there's a lot of reasons why people come to that point of concern about the vaccines, and it's important to not be dismissive of those concerns, even if we do have good data that says we can counter those concerns, and there's good arguments against that. But it's not stupidity.
Indeed. The next one is, in my opinion, one of the most important misinformation that we see around, and it's one of the most important to talk about and to just set the record straight, which is, it talks about how vaccines are not approved or safe. So this is obviously not true, but here is the tweet. So many various reasons why I won't get this jab. Words matter. Emergency authorization is not the same as approved, as in properly tested and is known to be safe and effective. Even then, shit happens. Gardasil, anyone? Nope, no thanks, I'm good.
Right. So, there's a, first of all, an EUA is an approval, but the tweet is right that in EUA, the emergency use authorization is not the same thing as a fully licensed vaccine. But the really important distinction here is that it's not that the EUA approval is not based on data, that it's not a thorough review or anything like that, because no, they wouldn't put a vaccine into production if we didn't have data that's saying that it works and is safe. And in fact, there have been vaccines that the data has not looked good and they're not in use. So it's not like every single COVID vaccine that has ever been tested is being used. No, we have very good clinical trial data for the vaccines. And that clinical trial data was what was evaluated in the approval process for the EUA. These were web streamed, they were open meetings. I attended the virtual meetings to see exactly the data that was discussed, how it was evaluated. And I can tell you it was a very thorough evaluation with a lot of data that was examined to say that, in fact, yeah, the vaccines work and they're safe. And now, the other side of, concern about vaccine safety, yeah, there are side effects of the vaccine, but very low rates of side effects, very low rates of severe side effects. And, the COVID vaccines are actually some of the safer vaccines that we have. They're very good. And right now, not only do we have all the clinical trial for the data, for the vaccines, but we have a lot of usage cases of millions of people that have been vaccinated with some of these vaccines around the world, and we keep collecting that data. So we have a really good repository of data right now that is saying, actually, these vaccines are really safe.
The next one is about how supposedly vaccines cause infertility. Here's the tweet. The mRNA vaccines are the most dangerous, of course, with spontaneous abortions even late term, and infertility being a major risk as the protein spike gathers in specific organs. All for a virus with a 0.23 IFR? Golly. Imagine if we got Spanish flu or the plague.
I don't imagine. I don't know what they mean if we had Spanish flu or the plague, because those would be worse, and we would want the vaccines even more than we already do. So I don't understand that. But first of all, the spike protein does, during the vaccine process, does gather in specific organs, specifically, your lymph nodes and your muscles where you get the vaccine injection. That's what it's supposed to do. The spike protein doesn't gather in, your reproductive organs or anything like that. But yeah, there were concerns, or not really concerns, but there was, caution in saying, well, what is the effect of the vaccine on pregnancy and fertility? And so this is something that has been studied, and we actually have really good data on that. And we have really good data that says, yeah, vaccination does not affect fertility. Hard stop. It doesn't. It doesn't affect male fertility. It doesn't affect female fertility. And it does not have adverse effects on pregnancy. We have data that they've done a large study with a lot of women that were pregnant, and looking and say that, the risks and the rates of, adverse outcomes during pregnancy were identical for the bulk population and women that got the vaccine. Now, the really important point to note here, though, is that the risks, both in terms of fertility and in terms of pregnancy, if you get COVID, are dramatically great, because we know that there is a real risk in pregnancy, And there's some evidence that says maybe the virus might actually affect male fertility in some cases sometimes. We don't have great data on that, but we know that there is a potential risk. So the virus, yeah, absolutely a risk. Vaccines, the data says no.
Okay, so that was vaccines. And now our last topic is, of course, one of the most important ones because of what we do with the series at Zero COVID Alliance. So we're going to speak about long COVID. So the first misinformation tweet is as follows. Long COVID happens only if you had severe COVID-19 and were hospitalized.
Right. So this is, there's a kernel of truth in here, but overall it's not true. So first of all, we know that anybody of any age with any severity, including asymptomatic infection, can develop long COVID. Anybody and everybody is at risk at that. That's the first really important thing to know. And the second important thing is that we have seen from several publications that patients that had a severe disease and that were hospitalized do seem to be at a higher rate, a higher likelihood of developing long COVID. Now, it's not totally clear if that's because there's more damage to the body and that takes a longer time to recover, or if it was a more robust infection that led to a higher likelihood of long COVID. So we don't know that, but in the literature, there is a correlation between saying you had a severe infection and you have a higher likelihood of developing long COVID. But again, that's just the likelihood. We know that everybody is at risk, and we see a lot of cases of long COVID of healthy young adults with mild infections that ended up developing long COVID that was far more severe than the initial infection.
Yeah. Okay, the next ones, I think we should make them short and sweet, or not too sweet, because they're very similar from one to another, but I want to mention them because of how they're written and just the fact that people think that it hurts. It hurts, So it's on anxiety, on stress, and so on. So the first one is as follows. There's two, and it's for anxiety. So one is long COVID isn't real. It's just lockdown-related depression and anxiety going full psychosomatic. Quote me. The second tweet, so you can speak about anxiety in general. Long COVID also looks a lot like panic attacks and anxiety.
Okay, so first of all, long COVID is a real disease. This is not something that is in people's heads. Are there parts of, other diseases that, have similarities to long COVID? Sure, but, nobody's having a, 12-month panic attack coupled with a whole bunch of other symptoms going on at the same time. And, when you're talking about sort of, lockdown, anxiety, and depression, well, there are a lot of people that have lockdown, depression, and anxiety, and this is horrible. This is still a really bad thing. But first of all, it's not the same. The symptoms are not the same. The intensity is not the same. The duration is not the same. And also, there are a lot of people that have this that don't have long COVID. It's so many of us have been in lockdown, but not so many of us have had long COVID. But also, you can do medical tests. There are, even those standard medical tests are not hugely effective. We don't have a diagnostic specifically for long COVID, but there are tests that you can do that actually do pinpoint things that are going on in long COVID. You can have a table tilt test. You can have, sort of microvascular CT scans that are looking for small signs of damage in lungs and blood vessels. There are things that can be done, and they show biomedical disease. So it is very clear. And, yes, there is anxiety that is going around now. People have a lot of anxiety, have a lot of lockdown fatigue. People that have long COVID also have that too, but it's not the same. This is a real disease. It's a biomedical disease. It's caused stemming from a COVID infection. It's a real thing.
The next tweets are, you're probably going to give the same answer. One of them is on stress, saying it's called stress. It kills and degrades all functioning. And then we have two for hypochondriacs, saying, LOL, there are no long COVID sufferers in Australia. They're called hypochondriacs. And the next one is, hypochondriacs will be hypochondriacs.
So I can just say, being stressed and worrying about a disease is not the same thing as experiencing it. And I think anybody that actually has long COVID, and I can't say this as I don't have long COVID, but anybody that does have long COVID, I think would say, yeah, there's no pretending that this is all in your head. There's no pretending that this is not real. This is a real disease. And, Australia not having a lot of long COVID cases, well, Australia doesn't have a lot of long COVID cases because they haven't had a lot of COVID cases. So the two kind of work hand in hand. But again, this is not something that people are just thinking about or making up. It's a biomedical disease.
Exactly. So tweets like the ones I just read, or even this one that says long COVID, also known as a few people who actually have it, then thousands of lazy people using it as an excuse to not get back to work.
Yeah, I mean, this is, if you don't have a perspective on what long COVID disease is, if you don't understand that long COVID is an incredibly severe, debilitating disease, it's easy to look at somebody and say, oh, well, you look fine. But in a lot of ways, long COVID is an invisible illness. It's an illness that you can't just look at somebody and say, oh, well, you look clearly ill, so yeah, I get that you must have a disease. Especially in the context of now where everybody's at home and we're on Zoom and you can just be sitting there, it's easy to look at somebody that has long COVID and maybe say, oh, well, you must be faking it because you look fine. But just because somebody looks fine for 5 minutes on Zoom sitting in their chair doesn't mean that they didn't have to, rest for hours after to recover from that. Doesn't tell anything about how they're feeling at the time, how much heart palpitations they have, how difficult it was to spend those 5 minutes. You can't see all of that, but it's not a mild illness and it's not anything that is in the head. This is a real illness.
It's a real illness, and empathy. Be empathic because you don't know what's going on behind the scenes, behind the screen of Zoom. Jeremy, for this episode, we are done. We have gone through some of the tweets we have received, but we can't go over all of them, obviously. So thank you. First of all, thank you very much. And then, I'm sorry.
It's my pleasure, and I just wanted to just leave everybody with just one real quick sort of idea. Is just there is a lot of misinformation out there, but there is also a lot of information out there, and so we've talked a little bit of how you distinguish the two. But just keep in mind, if you're reading something, read anything, especially anything that you're reading on social media. Take that with a grain of salt. Think about who's posting that and why are they posting that? What's the goal? How complicated is that argument? Is it a lot of things grouped together, or is it something really simple? Does it actually reference data, or does it just make these big claims? And if it does reference data, have a look. Maybe you don't need to necessarily know everything about what that data means, but is it talking about something from, decades ago? Or is it talking about something that just came out? And for anything that you have any concerns about, any worries about, you think, well, maybe this sounds too good to be true, or this is really dramatic, or is this true? There are a lot of good organizations out there that fact check information. So you can find that. Look for fact checked information, validate it. Don't just assume that anything that you read on social media is true.
Exactly. And just remember, as we well know, a pandemic is global. It's happening in the whole world, in the whole planet. So just think that billions and billions of people are not going to be lying to you.
Yeah, we have good science, we have good data, and we just, it's all about communication. And so, just pay attention to what you're reading, pay attention to where it's coming from, and just think it's good, always good to validate what you're hearing.
Exactly. Jeremy, it's been a pleasure as always. Thank you very much for being here and debunking some misinformation with me.
My pleasure.